We often think of medicine as magic bullets, drugs designed to target and alleviate specific ailments. But the world of medicine is rarely that simple. Enter anti-analgesics. These drugs, instead of reducing pain, can actually make us more sensitive to it. Imagine a minor injury becoming excruciatingly painful. This is the potential effect of anti-analgesics. They amplify our perception of existing pain. Anti-analgesic effects can be observed with certain medications, often as an unwanted side effect. Understanding these mechanisms can help us better manage chronic pain conditions. By delving into how these drugs operate, we can gain valuable insights into pain and develop more effective strategies for relief. Our bodies come equipped with a remarkable internal system for pain management. When we experience pain, our brains release natural painkillers known as endorphins. These endorphins act like internal morphine, binding to opioid receptors in the brain and spinal cord, effectively dampening pain signals. However, certain drugs can interfere with this system, effectively silencing our body's own pain relief. These drugs, often referred to as opioid antagonists, work by blocking the opioid receptors that endorphins normally bind to. Naloxone, commonly known as Narcan, is a prime example of an opioid antagonist. It's used in emergency situations to reverse opioid overdoses by rapidly displacing opioids from the receptors, thereby blocking their effects. While life-saving in overdose cases, it highlights the potential for certain drugs to interfere with our natural pain relief mechanisms. Imagine your pain receptors as tiny microphones, picking up signals of damage or injury and transmitting them to your brain. Now, imagine these microphones being fitted with amplifiers. Suddenly, even the faintest whisper of pain becomes a deafening roar. Certain drugs can increase the sensitivity of our pain receptors. This sensitization can manifest as an increased response to painful stimuli, or even as pain in the absence of any obvious injury. Consider caffeine. While often lauded for its stimulating effects, caffeine can also exacerbate pain in some individuals. By blocking adenosine receptors, caffeine essentially turns up the volume on pain signals. This heightened sensitivity can serve as a protective mechanism, alerting us to potential harm. However, when sensitization becomes chronic, it can contribute to chronic pain conditions. Our bodies have evolved sophisticated mechanisms for modulating pain, ensuring that we don't become overwhelmed by constant discomfort. Specialized receptors act like gatekeepers, controlling the flow of pain signals to the brain. These receptors, often targeted by analgesic medications, play a crucial role in managing pain perception. However, certain drugs can interfere with these gatekeeping receptors, effectively blocking the gates of pain relief. Opioid antagonists, as mentioned earlier, are a prime example. By blocking opioid receptors, they prevent both our natural endorphins and opioid medications from effectively dampening pain signals. Another class of drugs that can interfere with pain modulation are NMDA receptor antagonists. While NMDA receptor antagonists have shown promise in treating conditions like chronic pain and depression, they can also, paradoxically, increase pain sensitivity in some individuals. Inflammation is a vital part of our body's healing response. Our immune system sends inflammatory cells to fight infection and promote repair. But excessive inflammation can cause pain and discomfort. Certain drugs can worsen inflammation, fanning the flames. Pro-inflammatory mediators amplify inflammatory chemicals.